over the last 2 weeks, we've been covering a common psychological problem that affects many of us. And in its serious form, it can paralyse people and affect their work, study and relationships. I'm talking about anxiety, and it's anxiety that goes beyond the normal anxious moments that we all get from time to time. Last week, we looked at how anxiety disorders are under-recognised in children. This week, we're taking a look at adolescence with a leading expert in the field, Professor Ron Rapay of Macquarie University in Sydney.
When young people start to mature into the stage of being adolescents, one of the biggest changes is that they start to be able to think more abstractly. And so things like general worries start to become more important. And so you start to find what we refer to as generalised anxiety disorder becoming more of a problem, particularly in earlier adolescence. Generalised anxiety disorder largely refers to worrying about a lot of different topics. The other big thing, of course, in adolescence is social interaction, and separating from your parents and becoming more social is extremely important. And so we find social phobia becomes a very major problem, particularly around about middle adolescence.
How does that show itself?
The way that social phobia tends to show itself is very much through extreme shyness and not engaging with peers as much as other kids their age. So a lot of the socially phobic adolescents, for example, have real difficulty going on dates. They'll have very small social groups. They'll have good friends, but there may be just a few friends. They'll often not be invited to parties as much as other kids, and when they are, they have great difficulty going to the parties. And they might have a great deal of difficulty presenting the sorts of things that once they get to teenage, they have to start presenting in school and stuff, and that might be difficult for them.
So they love their computer?
Love their computer, and we do find that a lot of the socially phobic adolescents spend a lot of time on the computer.
When does it become a problem?
The anxiety in adolescence becomes a problem when it starts to stop them doing those normal teenage things. So a lot of the teenagers who are anxious tend to be very good and they do all the right things, and so in many ways the parents love them and it's fine, and when they're doing their studies and doing well at school, everything's going well. But where it starts to stop them having friendships, where they start to become maybe a little bit depressed because they're lonely and they're not getting out as much as other kids, where it's starting to interfere with them finding a partner and going on dates, or stop them doing their schoolwork because they can't give presentations or can't perform, that's when it starts to be something we need to do something about. And
what can you do about it?
We can engage with various treatment programs. One of the programs that we currently have for teenagers is based very much around a CD-ROM. So it's a sort of a semi-self-help program, and the CD provides a lot of very clear skills and strategies for the teenagers of how to help themselves. For example, it teaches them about anxiety so they get educated. It teaches them different ways of thinking in a more realistic way about situations so that they are less likely to interpret the world in a very threatening way. And it teaches them how to develop step ladders to go out and face the world. It teaches them ways of starting to approach situations and encourages them to try and face things that they're afraid of. We combine that with sessions with a therapist, so the teenager doesn't have to do it entirely by themselves. Parents are included or encouraged to be included, but they don't have to be. It's up to the teenager. And we can actually run a lot of those sessions with a therapist over the telephone or even over the internet, so we can make it very much a distance program that the teenager can pretty much do when it suits them.
With good results?
We're getting good results. We get results that are not quite as good as we do with younger children, and that's partly because teenagers are a harder group to engage. They're very dependent, they don't really want to be in therapy. But we're getting around about 40% of our teenagers at the end of our program who are free of their anxiety disorder, and that's a pretty good outcome. Anxiety can cause kids to have headaches, stomach aches, nausea. In some extreme cases, they actually physically throw up before some event that they're worried about. So that's a very common aspect of anxiety. Obviously, anything that's physical like that needs to be checked out, and you should go and see a doctor and make sure that there's nothing physically wrong. But if a doctor has checked the child and said that there's nothing physically wrong, then you can start to assume that it's probably part of anxiety.
So the treatment for the headache is treatment for the anxiety?
Very much the treatment for treating the physical symptoms is very much the treatment for anxiety. So we basically treat the anxiety as we normally would with one of our anxiety programs, and we tend to find those physical symptoms disappear.
What do you do about the teenager who is maybe using marijuana as a way of relieving their anxieties?
We tend to find that anxious children don't tend to use drugs or alcohol terribly often to control their anxiety, but it can happen in some cases. Where it does seem that a child is perhaps using drugs or alcohol to control their anxiety, then we would just treat the anxiety very much in the typical way, put them into a program for their anxiety, and then we would see whether the drug use decreases.